Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. Definitely, it is quite convenient for the study. Of course, we have been coming to the last part of this approach to child with developmental delay. So many pitfalls we have discussed, so many cases we have discussed, domain wise we have discussed. Now come to the management portion. Now, how to guide the family for further treatment? Suppose you have identified developmental delay. Now the challenge is not over. The biggest challenge is how you convey this message to the family members. It's not so easy. Okay, so how we can guide a family with a kid suffering from developmental delay for the further treatment, maybe like autism, maybe like CP, ADHD, neuroregression, and some other cause due to metabolic problems, storage disorder, etc. It's not so easy to convey the message, to tell the diagnosis. The first question comes, should we tell or not? Because it's a matter of emotion, matter of what you say, stability, psychological stability of the parents, and so many things are there. Should we tell? Yes, we have to tell. We should not delay. Many times already it was delayed when we diagnosed the patient, so you should not make further delay. Yes, you have to tell. Whether we have to tell or whether we should hide or we should not hide when the diagnosis is confirmed. Yes, again the answer is same. Yes, you have to tell the patient about the possibility, and you should not hide the diagnosis by the fear of losing the patient. Many times when I tell the patient that yes, this child has got autism, then they will go move into other faculty members, for example. So they now focus on speech therapy, behavioral therapy, occupational therapy. They may go to the higher centers. So there is also fear of losing the patient also. Yeah, this should not be done. You have to tell the diagnosis. This is the message. Now, when should we tell? Suppose we have to tell, then when should we have to tell? Never tell this problem to the parents when they brought the child for another illness. Many times what happens, child was brought to a simple fever, cough and cold. That time you have identified, yes, child is also having some developmental problems. That time you should not tell the parents that your child has got a bigger problem rather than this cough and cold. No, you should not tell like that. Okay, because the basic rule says that development should not be assessed when the child is ill. Development should be always assessed when the child is well. Okay, that means ill in the sense when the child is having some other infections and a cough and cold, fever, etc., diarrhea, etc., you should not go for the developmental assessment. Okay, so what we have to tell in this condition, although you are diagnosed during the time of the illness, ask the patient to come back again after 15 days once this particular illness over. Okay, so then you have to reassess the child when he is well and call them for the follow-up, and then you have to convey the message. Now, what should we tell? Now, never sugarcoat the truth. Okay, that means never sugarcoat the truth or hide it in a sugar-coated bottle. Like he has got some problem, I will give some good medicine. I know as a doctor, I know how to treat it, how to correct it. See, these type of ambiguity statements or confusing statements or sugar-coated statements should not be there. Once he has got the developmental delay, yes, he has got it. Now the question is how you convey it. That's all. You have to convey. Okay, so never adopt a wait and watch policy. Many times happens, just wait for 2 months, I will give some medicine, then we'll see. If it is not responding, then I will send. No, this is not the approach. Like he has got some problem, just wait for 3 months, let me observe. When the diagnosis is already over, is sure, or diagnosis is ensured already, then why you have to wait for 3 months? Already the child is diagnosed at the delayed age, and now we should not do that mistake. So never comment that cause of this problem is poor parenting skill. This is very important. Many times child comes with autism, ADHD, or many other developmental delay. So don't make responsible that your parenting skill was not proper, and that's the reason because of which the child is not able to develop well, maybe learning disabilities, etc. Okay, because you should not tell this part, because this makes the parents a lifelong guilt. Okay, this create a lifelong guilt to the parents that the child is today in this condition, that is because of my fault. So you should not create this guilt in the parents, because once the parents lose the hope, everything has been gone in this case. So never comment such sentences. Okay, okay, these are some of the basic things. Now how should we tell the basic things? Okay, when to tell, what to tell, whether we have to tell, everything is over. Now how to tell, this is a golden question, how to tell. Okay, now as a doctor we should practice of using the non-judgmental terms. You should not use the judgmental terms. For example, don't use the words like normal or abnormal, like he is normal, he is abnormal, he is good, he is bad. See, such things should not be used. So we are sometimes we have to use the non-judgmental terms. What do you mean by these non-judgmental terms? What you have to say, you know that child has got developmental delay, but what you have to tell, I noticed some atypical behavior in this child, which is not normal to this particular age group. Okay, or I have some concern about this particular child regarding social development of your child. Your child is absolutely fine, doing everything fine, but I am little concerned about the social development. He is not up to the mark. Okay, or sometimes the social communication is required to, sometimes you can say, see, some more social communication is required to your child. He is good, he is acquiring the skill, but the skill has to be acquired still more. It is not up to the mark. And do not say that your child is already late and delayed, etc. So you just tell your observation to the parents. See, I don't know whether the child has got some problem or not, but according to my observation, he has got little delay. He has got little delay, so we have to take care of it. Okay, so he is little delay in neck holding, he is little delay in walking, he is little delay in language. Don't say that he has got label him as a developmental delay child, but instead of that, convey in this way that he is little delay in language, little delay in walking, etc. Explain what is the pattern and age of usual development, and let the parents notice the difference. Instead of you telling and labeling the child as developmental delay, and you explain the parents that, see, usually a normal child will going to attain the milestone of walking by the end of 12 month or 13 month, but your child is not doing so. That is a matter of concern. Although he is 9-month old, he's still not achieved that much of the skill. See, this is how slowly you have to convey the message or convey the diagnosis. So what more should we do once you suspect the developmental delay? What more you should do? Now see, whenever you tell that your child is, according to me, your child is not attaining the milestone so properly, then immediate next question by the parents is, sir, what we can do? So you should be ready with that answer, no? Okay, so explain them for the early intervention and best results, never delay. Tell them very clearly that, see, earlier we intervene, better will be the result and good will be the prognosis. Prognosis will be good, so we should not make any further delay. So you have to consult this particular department, this particular doctor, or this particular therapy. Okay, so refer for the early intervention and need not wait for the confirmation of the diagnosis. Okay, many times what happens, child is little delay, 2 months delay, and diagnosis, clear cut diagnosis is not at over. So many times physician and parents both will wait till the diagnosis is over. So that again takes 2 to 3 months sometime. So we should not waste that particular 3 months of time. So once you suspect the diagnosis, and if the parents are agreed, immediately send them for early intervention. Okay, when the motor impairments and spasticity is there, refer them to occupational therapy, physiotherapy, visual stimulation therapy, and hearing rehabilitation. Autism, if the case is of autism, then refer them to the social skill training and also communication training. Provide the parents a good information source. That's very important. See, at this particular pitiable stage, what actually the parents require is they want a good information so that where they can go and treat their child, maybe the rehabilitation centers, speech therapy centers, or the occupational and behavioral therapy center, physiotherapy centers, etc. So that you have to provide a good information so that you can help to the parents. So these are also the basic things that how you have to convey the diagnosis to the parents. In the next class, properly we will deal with the therapy and management. Thank you very much.